All right, welcome to the new episode of All Things LOCS, where we discuss leadership, operations, culture, and strategies for growth. And I have a very special guest today. We have Tiffany Ryder, and here's going to be an introduction that you don't hear from most people. Former NFL cheerleader turned emergency medicine physician associate. I'd like you to find somebody who has that introduction. Now, she got a few other things going on as well, but you're going to dive right in. But Tiffany, it's great to have you here with us.
Thank you so much for having me.
Yes.
It's been warm. It's been an adventure. I've been in Vegas for about 90 minutes now, but I'm super happy to be here and just appreciate the invite.
Yes, welcome to the 100-degree temperature indeed. So let's get right into this, shall we? So that introduction, NFL cheerleader into healthcare. Please tell us a little bit about that journey and what brought you into the switch into the healthcare space.
Yeah, so I really think that my journey started in childhood. Even I grew up in a rural area in Louisiana and didn't really have access to healthcare, didn't really live in a community where people really understood how the healthcare system worked and how to get care or had insurance or anything crazy like that. And so anyway, when I moved to the DC area, I wanted to do something different than everybody else thought I was going to be able to do. And so I had gotten married, started a family. I was 19 years old, and I said, I want to do something really big. What could it be? And a friend of mine had tried out for an NFL team. I think she had tried out for the Ravens, and was like, hey, we should do this. We should do this. And I said, well, let's freaking do it. And anyway, so I did that. And it didn't go so well for me the first year. And I think this is honestly the beginning of sort of what got me interested in medicine. It didn't go so well for me. I tried out for 3 different teams, the Eagles, which I can't even believe now. I know.
Boo.
Can't believe. The Redskins and the Ravens, and just didn't even make it past the first cut. And I was an exercise science major in college, and I was talking to people and I said, I just don't really know what happened, but, I've already decided that this is what I need to do. So I guess I'm going to have to figure it out. And someone, lovingly said, well, I think maybe if you lost like 20 or 30 pounds and like got in shape, like maybe that would help, right? Like you would be more fit. You could do some things. So I said, well, okay, I think I look great, but okay, that's fine. And right around that time, I'd actually had a medical appointment with a primary care physician, and they had told me that I had prediabetes and PCOS, polycystic ovarian syndrome, and I had just sort of this collection of things that I'd never been diagnosed with because I'd never gone to the doctor. And I remember the doctor saying, well, it's okay. It's not a big deal. Right now it's prediabetes, and 5 years, 10 years down the road, you'll just you'll come in, you'll get a blood test, and then we'll notice that it's been elevated and that it's time to treat it. And that was the path that I was on. And so, the two were happening simultaneously, but they weren't intentionally related, not initially. And, but the end of the story, as I'm sure many of your listeners and you already know, is that I lost the weight to do the cheerleading. And then magically, all of these diagnoses just disappeared and I quit having problems and my blood work normalized. And that was sort of my first clue of why are we telling patients things that don't make sense? Why are we telling patients that they don't have power when clearly they do have power? And I only know about this one little piece. How many more pieces are there? And so that is a long answer to your story, but that is what got me started.
No, I love it. What's it like? Obviously I'm not a cheerleader, but I don't even want to like focus on that. What's it like being able to really overcome that rejection, right? Like, is that world very cutthroat? And what enabled you to actually? You said you got cut. You got some feedback that most people probably wouldn't have done so well with, right? It's like, I don't think anybody's like, okay, just lose 30 pounds. So you're telling me I'm overweight, but like, how'd you get through that process?
So that's my favorite question, and not many people ask that question, but I think it's the most important part of the story because we all end up in situations that we encounter difficulty that we don't know how to overcome. Yeah. And I think it's in those moments that we really have a chance to decide who we're going to be and where we're going to go. And I don't know. I don't know if it's that it was stubborn. I often wonder, right? I often look at that person, that little girl compared to where I am now, and I say, how did she know to just keep going? I think that community was a big part of it. I think that because I was an exercise science major and was around a lot of athletes and other people who valued physical activity and were interested in eating healthy in this sort of alternative ways of being healthy. But it was this, I think at the center of it was just a belief, a core belief that I could do it. And it might not be easy, and I might not know how to do it the first time, and I might fail a whole bunch. But if I just kept trying, I was going to get there. And I did. And the next year I did.
What would you tell somebody? Because, it's very easy. And, nowadays, especially, it's like you have to take action and you just got to put yourself out there. But then there's just people who they're just paralyzed by fear, right? They're paralyzed like, oh, God, what does that feel like to get rejected or be told something I don't want to hear? So if somebody was listening, like, how do I do that, though? What would you say, what would be like your core advice for them to kind of take that plunge and not be worried so much about that rejection?
Yeah, I think for me, it's finding other humans that don't take themselves too seriously. So if you have a community of friends that are awesome and they're willing to fail, and you can look at them objectively and say, oh, yep, you didn't get that job interview. This didn't happen, right? You can see them objectively failing and brushing it off and moving forward. I think it becomes much easier to realize that it's not just you. You're not the one who's broken and unable to do something. This is literally every successful person's story. Every person's story is failing and trying again and failing and trying again. And the only part that we see on social media or when we walk into an interview and we meet a CEO or whatever it is the end of those string of failures. And I think that many young people really struggle with that. And many people my age struggle with that. But I think that there is truth in that it's just about getting up and trying again. And if you get up and try again on an infinite timeline, there's no way to fail. And coming to terms with that and saying, I'm willing to do whatever it takes, and I'm not going to count what it takes because I don't know that yet. And if I did know, I might not do it. And that's really been inspiring for me and has worked for me. And I have one more thing. I always tell people, like, I'm not special, right? There's no secret sauce about me that made me particularly able to succeed in the things that I've done that I feel like are objectively successful. It's literally just being so darn stubborn that I'm like, I will not quit. And I think that any of us can get in that place and can adjust our environment to be there. And I love mentoring people and teaching and seeing that.
No, I mean, I like we said there. I think that part of it too is knowing what are we really going after, right? If it's like very haphazard, so to speak, and you get turned down for something, it's like, all right, well, I didn't really want it. Versus what's really more painful is dealing with the failure or the rejection or the no or not achieving that big goal you want to accomplish or that outcome. But you said, you said something interesting too. It's just about having that network of people, so to speak, that are maybe not completely like-minded, but they set this template, so to speak, of, hey, it's okay that we can encounter some failure. And really the biggest failure is, like you said, it's like just staying down and not getting up and trying again, right? So I think that's really important too, is like most people, like if they have they surround themselves with people who are typically like them, and if all your friends are afraid of failure and don't take any chances, you're probably going to do the same thing. So get some new friends, maybe it's probably a good idea.
I mean, being the smartest person in the room or the most successful person in the room or whatever, fill in the blank, is generally not the best idea I found. Like, I like to find people that are better than me in a variety of ways, right? Like, I find someone who is a better public speaker, who makes friends easier, who's really successful in their ability to, navigate difficult situations. And like, if you have those people who excel in different ways than you do, then you always have a role model and you always have someone to learn from.
Yeah. No, I love that. Now you're on social media a good amount, and you post some very interesting content in the sense of really, like you said, advocating for patients and calling out a lot of bullshit that you see in medicine. And I'm just, there's obviously a lot of misinformation as well, right? So I'm kind of curious to know how you kind of toe the line between calling out what is really factual about what you see, some behaviors, and we'll get into that from like medical doctors and people in insurance companies, but then also just keeping control of like some of the misinformation that you see about healthcare. So how do you, like, when you're out there advocating, how do you kind of toe that line, and how do you communicate to people in a way to empower them a bit, but also know what is reality in medicine since you're in it?
So I love this question because the whole premise of misinformation to me just says that there's a deficit of information. I believe that the cure for misinformation is just more information. And I believe fundamentally that people should make their own choices. I am an informed consent purist, meaning I really think that you should hear differing opinions on all sorts of things. I believe in the scientific method, which sounds ridiculous at face value, but I think for me it means that I know that 50% of the things that I know in my head, medical facts, things that are, we would say, are objectively true, that are printed in medical textbooks, I know that half of those things are going to be garbage. People are going to laugh at them 20 years from now, maybe 5 years from now. Diabetes used to be something that you couldn't say was possible to be reversed, right? And now it is routine. We tell people with elevated A1Cs, we say, it's early, and we think if you make these changes, you may not even qualify for a diagnosis of diabetes. And I think that's just one example. And we have so many examples of things that we say are facts in medicine. And I think that the real problem is that people believe in a concept of misinformation being widespread. And I think that in most cases, it's more nuanced than that. It is this the right drug for this patient in front of me? And that's a different conversation than is this the right drug in general for other 32-year-old males living in Nevada, right? So
no, that's a good point, right? Because then it's just like, all right, the science, and that is actually, I think, and I'm curious to know your opinion, but for me, I feel like science is, you do find some people that are kind of going after science and the data, right? It's like you present them with facts, and it's, well, I'm going to still ignore it and go with my opinion. But to your point, it's like, all right, well, the data shows what works, but everybody's different. And I do think that's part of the challenge is, am I getting a treatment plan almost that's really customized for me, right? Versus, are you maybe giving me something that the drug rep told you works for this condition, but it doesn't fit my lifestyle, it doesn't fit who I am. And I do think that's very different. So how do we, for you're out there educating the public, what are some things that they should look out for, so to speak, when you go to a doctor to, hey, I have some questions, but don't go in there as like a full-on skeptic where you don't believe anything that's being directed towards you is factual.
Yeah. So I think a great way to go about doing that really works in every situation and for every human is to approach your clinician with gratitude and humility and say, look, I know that I am not the expert on all things diabetes, but, I know that last time I was here, you were recommending that I take this particular drug regimen. I did the best I could to learn about it. And here are some things that people are concerned about. Can you help me understand why you've chosen this particular medication for me? Because, I know it doesn't work for other people, but like, why do you think it's important that I take that? And any clinician, like, worth their salt will say, I understand that concern is relevant in this situation, and this is why I think it doesn't apply here. Or, you know what, that is a side effect that a lot of people experience, but your diabetes is so uncontrolled that I'm really concerned that your kidneys are going to suffer long-term damage, and we really need to do this for a period of time, or whatever it is,
Yeah.
right? But it's like, it's a conversation. And what I tell patients across the board is, if your doctor or your clinician is not willing to come to the table with you, then maybe it's time to explore having a new one, right? Because we can't be in a relationship that is completely subservient. When I go to physical therapy, I'm not a physical therapist. I don't really know, but I should be able to ask questions and say, well, this hurts. Why are you recommending that I do this thing that hurts me? And you should be able to have a reasonable answer that then I can consider, am I willing to do that or not? And when I mentioned earlier being an informed consent purist, I mean, to the extent of, I've had patients in the emergency department who are septic, who have a blood infection, who have very serious things going on, and they need treatment. And even in those situations, I don't feel like it's my right to tell them what to do with their bodies. I do think it's my responsibility to say, I believe that you need these IV antibiotics, because I believe that if you don't consent to them and you don't take them, that there is a very high chance that you will die in the next 24 hours or whatever the conversation is. But even then, I really think that approaching patients and just being very clear with what the consequences are is the best approach over saying, you're going to take this because I said so. And I think there's a lot of that happening in medicine still.
Why do you think that is?
I think that it was always the way. I think that I'm certainly not trying to put down clinicians or physicians. I mean, the system is just hammering people into the ground. There's too much charting. There's inefficiencies in practice. So private practices are having trouble collecting enough insurance reimbursement or, funds in general, paying their staff, keeping the lights on, recruiting enough patients. There's systemic issues. I'm spending too much time charting. I'm charting on the weekend. My spouse is yelling at me because I haven't seen the kids in 3 days because I'm doing all of these things. And maybe I don't feel in that moment like I can have a half-hour conversation about this metformin, and I just need this patient to take
the
it
drug.
because I went to medical school, right? And I think they just get super frazzled. And that's not an excuse, right? But I think that there are reasonable concerns for why that is. But I also think that for a segment of clinicians, that's just how it's always been. I say what you should do, and it's your job to do it. And I think that is the place that we should be pushing back and saying, I understand you're the expert, but also it's my body, and can you help me understand?
Now, with the approach that you have, definitely, I'd say, and you can correct me if I'm wrong, it definitely sounds a little more empathetic, right? Just all right, let me have a conversation, see your side of it, hear your thoughts on it. Do you think that's just the way you are? Do you feel like that was maybe due to some of your past experiences, not in healthcare, or related?
I think that's just who I am as a human. And when I first entered this world of patient advocacy, I did see a lot of people who approached it from the perspective of, well, the doctor is evil. He has been corrupted by big pharma, and he's telling me what to do, and I'm not standing for it. And I thought, well, when the patients come in and talk to me that way, that makes me feel like garbage, and none of those things are true about me. So, how can we really enter into this conversation as consenting adults and say, you're the expert, I'm the patient, I need some information and guidance from you. You want to help me, let's go. And I've found that approach tends to work really well. It works really well for me, even as a clinician in the emergency room when, the nurse comes in and says, oh, the patient in room 8 is a disaster. They are mean, they are hateful, they're cursing everyone out. And I've never been cursed out. you know, like, and I'm not saying you can always avoid it. Maybe I've been lucky, but I do think that coming into the conversations with love and empathy and understanding that the doctor's job is really hard and the patient's being sick is really hard and everyone's doing their best generally put you on the best foot.
Yeah. Yeah. I mean, like, at the end of the day, nothing's personal, right? It's like you said, doctors and medical providers, they're dealing with their own bull crap.
Yeah.
Patients, I mean, that's the thing, right? It's like if you're seeing somebody at your office, they're not doing well in some sense, right?
Nobody wants to be there.
Nobody's coming in like, I feel great. I got nothing going on today, so I figured to come in. Like, everybody's in like a tough spot, whether due to pain or just their, way of life is being changed. And it's like, you got to give people some grace. Now, you're in an environment, being in the emergency room, that requires a lot. What's it like with regards to communication, collaboration? Like, how important those two facets to actually having just, I don't say a great day, but like ensuring a great patient experience, but then also a great employee experience?
So in my experience, I've only worked in rural ERs. I've worked in 8 or 9 of them over my career, but we communicate well. I get along well with the nurses. They get along well with me. I get along well with my attendings. I haven't had any issues there. Where it breaks down for me, there are a couple places it breaks down. When you have a patient who is particularly sick, and maybe you're spending more time with that patient, or maybe there's a pediatric code or emergency that comes in and everyone is really focused on that, it's very easy to get distracted and to lose, forget a question to ask. Like, this is what I tell patients, like, we are literally just humans. We are not perfect, which is one of the things that I really struggle with, because no matter how hard we try, like, you cannot be on 100% all the time. And so having a patient who is willing to come back and communicate and say, oh, hey, remember you mentioned this other thing? Do you mind writing that script? Or you have, something that I'm not sure is relevant, but it happened, is X, Y, and Z. I had a fever 2 days ago and it went away. Is that relevant? And sometimes it is, and sometimes it isn't. But those things are important. So teaching the patients that it's really their job to come to the table and present the information in as organized of a manner as you can with a timeline is really essential. And the place that I do see it break down on our side is once the patient leaves the hospital. And this is honestly how I ended up writing online and really getting into this more patient advocacy, health policy, communication space. Was I realized that we can't fix it from the emergency room because we are sort of the safety net for literally everyone. But then we would discharge patients. I can treat them while they're under my care. But if they're not sick enough to go to the hospital, but they don't have access to medications and treatments and specialty appointments or primary care or anything outpatient, it really makes it impossible for me to actually help that person. And not only that, but now they've paid $2,000 when it's like 80% of Americans don't have $500 to spend on an emergency. And now I've basically made that patient financially stressed and pressured and perhaps destitute, and I haven't even been able to help them. And that to me was a situation that was unacceptable and is just completely untenable. And instead of blaming the patient or blaming the doctor or blaming the hospital, I think that we need some focus on solutions that are working.
Now, I like that because I feel like that's very common in the sense of people just like doing their job, right? It's like, well, I did my job, like on to the next. It's like, well, there is no next for that person. So what do you do? It's like, well, that's not my problem. Like, I did what I was supposed to do. And I remember like even like way back when I was in school, like I had a kind of like a similar scenario, and I'm like, they're going to go home and they're going to get this kind of care. And like, the person was like helping me out because they're like still a student. And they were like, who's at home with them? I was like, oh shit, I don't even know. Like, what if they don't have anybody to help? I was like, then what? I was like, oh shit, dude, I didn't even think to ask that. So it's like stuff that we don't think about that maybe kind of we pass the buck to somebody else, right? It's like, well, I'll kind of like just do my job and hope somebody else picks up the slack. But you don't think about that after effect. It's like, what happens when they walk out those doors?
Yes.
How am I actually like, does my impact end here? This is why I like give you a ton of credit. It's like, or does my impact kind of extend beyond that? And I know that's, like you said before, it's like a lot of people out there want to do that, but there may be just, I don't have the time to do that, or I don't have the capabilities or the knowledge. But, like we said there, there's a lot of problems. It's like, how do we start creating not even just some solutions, but opportunities? And I think that's what it sounds like you did. It's like, all right, there's some problems here. So let's get into some opportunities that now you're creating to actually continue that journey for a person once they walk out the doors.
Yeah. So, I mean, the way that I even found out, right, is you would have patients who would come back in and you're like, well, this person was here 4 days ago. Why are they here again? Right. And also I was a little nervous, and I would call my patients that I saw in the last shift and I would say, hey, how are you doing? Are you doing better on that antibiotic I gave you? And instead of the happy stories, sometimes you would get these devastating stories, and you started finding this out.
Yeah.
So it became really clear to me that something needed to be done. And I said, well, I don't even know what the heck to do. Like, what are the opportunities? And I think that a lot of us feel that way because I can't work overnights in the ED and then somehow get this person outpatient care. Like, I literally don't have that skill set. I just don't know what to do. And I didn't know what to do. And I found that I was getting, I wouldn't say depressed, but just demoralized and didn't feel fulfilled because I gave so much of myself and my life so that I could help people, and then now I don't even get to help people. Like, what is that? So I didn't know what to do, and I said, well, I'll just write on the internet. Someone was like, why don't you just post about it like on LinkedIn and like see if somebody has any ideas. I said, well, I don't know. I don't have any better ideas, so who cares? So I started doing that. And what happened was, I mean, I would say it feels like it happened very quickly, but other people would reach out and they would say, oh my gosh, like I've had that too. I feel that too. So I was getting this community of people that were really reaffirming that I wasn't just nuts. I wasn't just incompetent. Like, it really was not working for patients and therefore not working for clinicians. And then I started meeting people who were saying things like, well, yeah, that's a real problem. I founded this company 3 years ago and we work on this piece. And, someone else, I founded this company and we work on this piece. And then I discovered that there is a whole network of people who are looking to solve these problems. And in the grand scheme of things, maybe they are smaller solutions at the moment, but they're growing like wildfire. And someone recommended to me, they said, have you ever heard of Dr. Marty McCary? He lives out near you. And I said, no, I don't know. And they said, he was that guy who made the checklist. And I said, yeah, I know that guy. And I said, well, he wrote a book and you should read it. And that was it. I read Marty McCary's book, The Price We Pay, that really outlines a lot of these systemic issues. And I read Marshall Allen's book, Never Pay the First Bill. And then I went through both of those books and highlighted all the names that were mentioned, all the references. And I started reaching out to those people on LinkedIn and saying, hey, you don't know me, but I know you. Tell me what you're doing in the space. And that's how I ended up here. And, my value proposition has always been, look, I just want to teach patients how to navigate healthcare better. I don't really care how I do that. It would be really great if I could help pay my bills like doing that, but I don't know what that means. But what I found is that when you align the incentives, so when you have a company who benefits when their patients are healthy, then they're happy to participate in that mission, right? And that's sort of the space where I've found myself, and it's really cool because they're super happy because their businesses are growing and their patients are healthy. I'm super happy because I'm helping patients and I'm teaching them and they aren't getting taken advantage of. They aren't being treated poorly by their clinicians. And I'm getting to meet new people all the time, like you, who are interested in making positive strides in this space.
How much of it is the lack of patient knowledge versus the lack of knowledge from the provider side as it relates to the way insurance and healthcare actually works. At least for me, like I find that's like usually half the battle. It's like, well, my doctor told me such and such. I'm like,
Yeah.
your doctor doesn't know what the hell he's talking about.
Yeah.
As it relates to the insurance. Great doctor. So I'm
Yeah.
curious to know, like, from your experience, what do you see?
So I think those are two separate things. My school must hate that I share this story all of the time, but I'm going to share it real quick. I was sitting in a class, and I told you that I grew up without really access to healthcare or health insurance. And so I'm sitting in this pharmacology lecture. We're learning about different medications, and they're teaching us about the medications that you would prescribe for a urinary infection, like a bladder infection. And this one works for if it goes to the kidneys, this one doesn't, this one works for these allergies, blah, blah, blah. There's like 5 of them. So we get to the end, and they say, pretty much, within those parameters, you can just choose like one of these 3. Choose your favorite. And I was like, well, I don't really like this, but okay. You can look at what's worked in the area. Like, there are nuanced ways, but they're like, outside of that, it's really just you're going to find one that you like. And so me, the poor person in me, right? Little Tiffany said, whoa, how much do they cost, right? Like, we should probably know that. Like, I want to work in the emergency room, and not everybody there has insurance and access to, money and whatever. And I said, so I raised my hand, and I was like, well, could you, how do we find out how much they cost? So that way, like, if all these 3 are equal for this patient sitting in front of us, like, maybe I want to give them the one that they can definitely afford, right? And I was scorned. Oh, I was in trouble. Like, I got reamed out in front of the whole class, and they said, it's none of your business how much these drugs cost. It is your job to deliver the highest quality of care possible, and that is your job. And that was it. And it was delivered in such a manner that it wasn't like, I have a follow-up question. I was like, okay, I'm never going to say anything again. Yeah, exactly. and I think it's important, and I tell that story because literally the rot of what we don't know, like the vast ocean of what is not taught is wide, right? Now, I know many private practice, direct primary care doctors who can could sit at this table and teach me about insurance for the next 3 weeks, who know because they figured it out. Yeah. But I think that none of us are really taught well in school. We have to go out of our way to do it, and it is not made easy. And there are hospital policies, practice policies that require you to follow different treatment algorithms, despite what insurance will pay for or what is recommended, what is standard practice. So I just think it's more complicated than patients even know. Your doctor knows way less about insurance. You should assume that they know way less than you think they do. And, if you have one of those magic unicorn doctors who understands the way payment systems work, then that's really great. But I would say that it is a process for them to get there, even the ones who are really good at it. And to your other point about a deficit of knowledge on the patient's side, the message that I think is key for the patient to take in is you don't have to go to medical school yourself. You don't have to pick your phone up and know everything about a kidney infection to be able to make a decision. It's really nice if you can. I certainly feel safer now when I need medical care. But I think just taking that first step gets you 80% there. So taking the step that says, it's okay if I ask questions. It's okay for me to make sure that I know what the heck is even being said and what I'm supposed to do when I walk out of here and when I'm supposed to go. You leave the emergency room, you should know when to come back to the emergency room, when to go to your primary care doctor, when to call your primary care doctor. And I would say that most patients, when they leave either their primary care office, specialty office, ER, if you ask them, do you know what's an emergency and when you should call 911 versus when you should make an appointment versus when you should call, they have no idea.
Yeah.
And that is something that is within your control as the patient, is to just ask those questions and to make sure that you slowly navigate yourself to a clinical team that's willing to engage with you in that way and that respects that and appreciates it.
Yeah. Like we said there, it's like, even if you just know, I don't know everything about the condition, I don't know everything about the insurance, but I know what behaviors I should maybe exhibit, right? The ability to ask some questions, or just, when's my follow-up? You know, even like I'm talking to my mom the other day, she's like, now she's made this mistake multiple times. My mom's very intelligent, but she's like, I go to the doctor and then I assume they're going to get the records from like the other place that I went to. And I was like, can you like do me a favor, stop assuming? So last doctor, she's like, all right, I called the practice. I had them fax everything over. I was like, you gotta, like, the things that you can control, I was like, you gotta stop thinking that they're gonna like reach out for. I was like, they're shorthanded. Not every place is organized. I mean, she's had records misplaced that could have been bad. I'm like, you gotta start advocating a little bit for yourself, in the sense of, I think that's where people get a loss. Like, what does that mean? Does that mean I just get in front of a medical provider and then question literally everything they say? Or it's just, no, it's just ask questions, have some follow-up. You know, it's like, I was talking a few weeks back, and my mom was watching one of the episodes. She's like, I had no idea doctors are dealing with all that. It was like burnout and the amount of physicians that are quitting or not opening their own practice. And she's like, I had no clue. That's probably why it takes me like 4 to 6 weeks. I'm like, it's not a great reason, but it is the reason. She's like, man, maybe I'll think a little differently. I'm like, that's kind of the point, is like, you don't know the other side of it. So focus on what you can control, and take a little bit of initiative as well, not just rely on everybody to do everything for you.
Yeah, because we want to. We do.
Yeah.
But that doesn't mean that we can.
Yes.
Yeah. And I think that's how I've ended up working with the different companies that I've worked with. So I advocate for DPC and work with a lot of different DPCs, these direct primary care providers. And for me, I don't have stock in this, form of primary care. It's just, I see that when the patient is the customer and when the doctor has less patients that they have on their roll that they have to take care of, things get done better. Yeah. It's more efficient, right? And so I think everything that I do goes through that lens. And so I do end up being biased towards getting health care when you are directly paying for it. Generally, if a practice is able to engage with a patient about finances, then that means that they had time to do that. The staff is informed. They have autonomy and agency. They can do these things. They're not bound by contracts that you don't even know about behind the scenes. And so the closer you can get to being the customer, the better. Yeah. And even outside of that, the closer that you can really be the project manager of this whole arrangement, the better. And I think that patients generally assume their doctor is the project manager of whatever diagnostic sequence is happening, whatever test you need and whatever medication you need or whatever. You just assume that the doctor's office is in charge of moving all of these pieces, but really you're in charge of moving all of those pieces because you're the best positioned to actually find the links and find the missing symptom that you forgot to tell the doctor about, or that side effect that actually might point to something else. And you paying attention to that and feeling empowered and feeling like it's your responsibility means that then you're able to go in and say, hey, here's what I noticed. What do you think? And then the clinician can actually do their job.
So we're going to little shift here.
Yeah.
And I love that response. That was amazing. So hope who's ever listening, take that advice because it's solid.
Yeah.
Politics aside.
Okay.
And it's not that you're in that area, you're in Annapolis, not far from DC, but what's your opinion on where we're going with the government and healthcare? Obviously a little bit, with RFK, so to speak. It's not like political spectrum, so to speak, but just like, how do you feel about where he's kind of maybe gravitating us a little bit, or just, some of the stuff that is a little conflicting for some people, but I'm kind of curious to know what your thoughts are.
Yeah. So So I'll answer your question first because that is the polite thing to do. I mentioned Marty McCary earlier, and he is now the commissioner for the FDA. He just brought on another doctor, Vinay Prasad, who is a hematologist oncologist, to lead one of the larger divisions that really does all of the regulation and deciding what's going to happen with vaccines and biological medicines. I explain to my patients biological medicines are like the things that you take and you have to inject them and they cost like $10,000 a month. That's the clue that you're on a biologic. And I followed both of them for years. So it's funny that you're saying words like politics aside, because for me, it really is politics aside, because these are just humans that I have followed their work for years and years. And they are very data-driven people. They are very interested in seeing the right studies done. And I feel incredibly hopeful, actually. It's funny because you read like Stat News or you read a lot of these mainstream scientific publications, science, whatever, and they have very negative slants, meaning they use words like, oh, this contrarian or this what have you. But I don't see them that way at all. I see them as free thinkers. And my favorite thing about actually the whole lot of people that are sort of running the health agencies right now, Jay Bhattacharya is in charge of NIH, and RFK Jr., I mean, completely independent of any of their beliefs. They've published books. There are long form papers. Vinay has a YouTube channel with hours and hours and hours of him ranting about what the government's doing, ranting about the FDA. So I love that there is information out there, directly sourced data on what their beliefs are, that, again, I'm not the judge and jury to say are right or wrong. I have my own thoughts, but you can go as a patient and listen to some of these. You can read Marty McCary's newest book, Blind Spots, where he talks about a lot of things that we hear on Facebook or, in these colloquial places, like the gut biome, the bugs that live in your gut that are disrupted by things like, when babies are born via C-section or when you take a lot of antibiotics in childhood. And he really brings to the forefront, or he brought to the forefront in that book, a lot of the more recent studies. The book came out last fall. And you can go directly there and learn about how taking probiotics affects readmission rates for patients with schizophrenia. How we told women that HRT was going to give them breast cancer for years after we knew that wasn't true, and for years after we saw that the study didn't show that at all. So I think that it's refreshing to be in a time where you can look at what is being said and you can make a determination on how you feel about that. Whereas before podcasting and all of these other sources of info, we were just victims. We were just sitting here waiting to be told what to think. Yeah. And now we have access to actually see and make determinations.
Yeah, it's funny to say that. Like my wife hates Twitter, but I go on Twitter a good amount, but I'm not like doom scrolling. But she's like, "What are you on Twitter for?" I'm like, I like being able to see the stuff I didn't used to be able to see, like people sitting in Congress, getting vetted, like the stuff that I don't watch C-SPAN back in the day, but I'm like,
we should have watched C-SPAN. Let's be honest.
In retrospect, my grandmother might have had it right, and I'm like, what are you watching this boring shit for? But I'm like, nobody watched that. But like now you get to see what people are saying. But there is this aspect, I think, to your point though, is understanding like I can make a decision, but also take into account what is fact versus opinion, right? So, and I think that's the challenge that we have nowadays too, is that people kind of misconstrue opinion with fact. Or it's just like, I like this person, so whatever they said, I'm going to do that. Like, did you even look up their source. Like, you mentioned
Yes.
reading a book and then going to the reference and talking to the reference. It's like, are we even doing that? Or is it just, well, I follow this person on social media, or I like this person's approach. It's like, all right, you questioning them doesn't mean you are going against them. That's actually like good science is questioning stuff, right? It's like, we know that. It's like, you don't follow stuff blindly. So it's very interesting. It's definitely different. But it's just very, very interesting how these thought processes kind of have panned out, so to speak.
Can I talk just one more thing? Tell you one more story about this. So I was watching Marty McCary's. He was, I don't know, testifying at Congress like Thursday. I think it was last Thursday. And someone brought up, and I bring this up because the headlines were like completely misleading. Someone brought up the pharmaceutical that causes an abortion in early pregnancy. And when it was originally approved, the studies look at how many women maybe have infections or any sort of side effect, right? And they say, oh, okay, it was whatever it was. Some number of women had some number of side effects. And there's another group who did a more recent study, and they said something completely different. So this congresswoman is asking Dr. McCary, said, well, are you going to listen to this study done by this crazy group? I don't even remember who the group was. And, and she goes on like talking about like why this study was so bad. And I'm not saying it's good. I haven't seen it. But the point is, she's talking about why the study is so bad, and nothing in her discussion had anything to do with the study or the science, right? Like, I very much believe that this group probably did have some of the opinions that she mentioned, but the reality is, well, the pharmaceutical company had bias when they initially brought it to market, and these people have bias because they have bias, and none of it really matters, except I want to know, was there fraud in either one of these? And how were the studies put together?
Yes.
And are they real studies, or are they studies that were specifically designed to be fraudulent in any of them? And then we can actually have a conversation, but like you can't even enter the room. Like you can't say, what do you think about this study or this study? Like, I don't know what I think about them. What does the math say about them? And I think that is where we are, what you just described, where we make opinions about things based on who's saying them. And we've lost this thread that there is an actual reality. There's an actual number of humans who have a negative effect to this drug. And there are an actual number of humans who do not. And maybe we start with just figuring that out, right? Yeah. And then have a conversation.
I think it's like a little bit, we've lost the ability, so to speak, to critically think.
Yes.
I mean, who actually had it in the first place, but like whatever we did have starting to kind of slowly erode. And then, you kind of bring up a good point, and then I'll shift over to what you're doing these days. But what actually constitutes, like you said, a good study, right? It's like, how many times you see on the news, it's like, hey, eggs are good for you, now they're bad for you, and this and that. It's like, go back and forth, and it's like, what are you guys doing? It's like, well, we studied 5 people versus 1,000. It's like, what actually makes a good study, right? Yes. People are just like, I made a study. It's like, that's great, not knowing it was bullshit. And it's just like you said, like kind of made in a way that shows what I'm looking for it to kind of show. And I think that's part of, kind of going back to like, we talked a little bit at the beginning of like, maybe misinformation is just lack of information. And that's part of it too. It's like, here's what a good study in our field looks like, and here's how we determine what to take from that to actually pass on to you people as the patients and consumers. Mm-hmm. Now, what are you doing these days? You talked a little bit, but I feel like there's just so much stuff that you're working on. I could probably fill a whole nother podcast session with that, but like, what's some of the exciting stuff that you're doing outside of just advocating for patients? I mean, you got your podcast, you got some other companies you're helping with.
I do. Before we move on, can I say one more
Sure,
thing?
Of course.
Okay. So to your point about being absolutely certain, I think that is another red flag. So for patients, for anybody who's listening, and we're all patients, if your doctor says they know with 100% certainty that eggs are horrible for you, and if you have 2 eggs a day, you're going to die, you need a new doctor, right? And if a doctor says that eating 25 eggs a day is completely acceptable and everyone on the planet should do this, or, replace eggs with a pharmaceutical product, replace it with anything else. This whole like all or nothing thinking is a big red flag.
Yeah.
So
like, I will get you better, like guarantees and things like that.
Yeah. Yes. This medicine is the only medicine for this, and it's amazing, and it works in 100% of cases. Does it?
Yes.
No one gets side effects, really. Everything is a risk benefit, and I think that is the premise that we should go in with.
Yes.
Okay.
Yeah, great point.
Okay. Sorry, I couldn't let that go.
No, that was good.
Because I just feel so passionate about it.
I'm glad you brought that up.
Okay. So I am doing a couple of things. I'm working with, again, like I said, alternative solutions. So one of the things that really bugged me when I quit work and went back to school and studied medicine and was broke and had a horrible deductible and no time and was just sort of a mess on that front was that it was so darn hard, right? Like I ended up getting a plan. I'd looked on the marketplace. I wasn't happy with that. I had looked on through my school, and it was really challenging. You need not just health literacy, like an ability to understand clinical topics, but you need this huge amount of understanding for what the heck is a deductible? What the heck is a coinsurance? What is this? And when I got to the end of that path of learning all of these things, for me, insurance didn't really make any sense. Like, I really just need some help if something crazy happens. But I pay for a direct primary care subscription that costs less than my cell phone. Got the Mint Mobile plan, abandoned my $100 plan, and now I'm even. So I was already using direct primary care and was looking for a way really just to feel nice about having something in place to help if in the case of an emergency. And I found that through this company, Crowd Health. I am not working as an employee with them, but I'm a brand ambassador for them. And so I met with the CEO when I was going through this process of like, who's fixing healthcare? He raised his hand. And I was on the phone with him last year. And I said, I just have this passion. I'm already reaching, this many thousands of people, but I want to do more. I want to get the word out. I want to help more people come to the table with their doctors and their insurance carriers and, all of this. How do I do that? And he said, how about if you started a podcast and like I sponsored it? And I said, yeah, I'm not going to sell my soul to anyone. Like I'm not taking on sponsors. And he said, no, it doesn't have to be like that. Like, why don't you just help patients? And then, we can do this. And so that was sort of the start of taking on a lot of different roles where I'm able to actually help people learn how to navigate not just clinical situations, but also in the financial realm. And what I love about the podcast, which is called the Healthcare Liberty Lab, for anyone who's interested, it's on YouTube and Substack and, Spotify.
We'll have the links for it, all right.
All right.
Yep.
Yeah. But like, what I love about that is that, of course, that helps Crowd Health members. Of course, that helps people who are utilizing DPC in their personal lives. But it also just helps someone who feels helpless and feels like they're spending $14,000 a year on healthcare and they don't have anything to show for it, right? So I'm doing the podcast. I'm doing some writing on Red Flag Hero. I find myself incredibly interested in policy discussions and do some consulting on that side as well. And basically, I am open to talking with anyone who is interested and passionate about getting patients in a position of power so that they can take control and get better clinical and financial outcomes.
Damn. Okay.
Yeah.
Yeah, I love it. I mean,
yeah.
I got nothing else for you. I think that's a great way to end it. I love the message you have. Well, like I said, we'll drop some links in the show description.
Appreciate it.
Website, podcast, LinkedIn. Guys, definitely check her out. Her content's phenomenal. Great voice. Educate yourselves. That's one of the things here. Like, learn as much as you possibly can. and help yourself take some control. Tiffany, it's so great to have you. I'm so glad you made it in person from Annapolis to Las Vegas. Pleasure meeting you finally.
Yep.
Thanks so much.
Thank you.